I'm in the Rural Health Sciences PhD program at Mercer, and I'm graduating in May. And I serve as the Executive Director of Finance and Administration for the School of Medicine. The reason why I wanted to get this degree was to help in my job that I had, which was going and opening up primary care clinics in rural Georgia for Mercer Medicine, which is our physician practice, and wanted to learn the reasons why these areas needed these clinics and what we could do as an organization to best improve the healthcare access and health outcomes in those rural communities. The history of Mercer Medicine is it started out at Mercer Health System as a campus student clinic, and over the years it turned into the School of Medicine's physician practice. We opened a multi-specialty clinic in downtown Macon that had primary care and several subspecialties. And then we started looking at opening rural clinics in these rural counties that needed help. Over the past 6 years, we've opened 7 rural health care clinics to address those needs in some of the most rural and underserved areas of Georgia. Well, I think this program provides the research base for the people that want to go out and do the research in these rural areas to help the physicians that we're training to go there, and they can work together and really solve those problems in those rural areas. You know, for somebody that doesn't have a background in science, I learned a tremendous amount from every class, from every faculty member, and it stretched me in how I thought about things and how I learned things. So it was a rough 3 years, but it was well worth it because I learned so much. Everywhere I lived has been rural, and I was diagnosed as a type 1 diabetic when I was 9 years old, and we didn't have any doctors, so it was hard to manage, and I've pretty much paid the consequences of that disease over the years because I've never been close to doctors and always had to travel to see doctors. You know, as you get older in life, you really want to find a way to make a difference. I want to get those doctors out there in those rural areas so kids like me that are going through what I went through have access to doctors and can get the care they need so they don't pay the long-term consequences for having a chronic disease. When you see the impact of the progress that we're making in these rural areas, you know, it's exciting. These people have health care access that they can actually get to and they can use. So, you know, it makes you feel great. It makes you feel proud of what you're doing.